to everyone to another Massmetic event. I am Rachel Robinson, Vice President of Massmetic, and we're thrilled to have you here joining us for another virtual program. Kudos to all of you that have hung with us. I know the last year and a half has been an incredible journey for so many of us, and fingers crossed we're seeing some light at the end of the tunnel. It'll be great to get back in person and get to see all of you who've been joining us so wonderfully for these virtual programs, but really do appreciate all the support. Wanted to give you a little update on some upcoming programs. Make sure that you're in the loop. We do have a number of virtual webinars this month. I would highly encourage you to go over to massmetic.com and check out our events recording option. So we do have a number of virtual events, as I said, including our town hall on June 10th, which is all about sustainability in medtech. So understanding how that's a viable business model. So you definitely don't want to miss that one. We have a number of other things obviously going on. So please feel free to check out the calendar over at massmetic.com. And we'd love to hear from you if there are certain type of events that you would like to have more of in the future. Obviously, we've been able to collaborate with a number of our members on programs just like this. And we're so thrilled to have Goodwin collaborating with us on this and spearheading this effort. Digital health is a huge topic, which we're going to get into. So this is going to be one sliver, I believe, of that topic with a lot more to come. So before we get started, I would remind you all just a couple housekeeping things. Make sure to keep your microphone on mute so we have as little background noise as possible. However, we do highly encourage questions. The whole point of today's event is less of a presentation, more of it, let's answer questions and talk with Delphine about some of the things that obviously Goodwin has been seeing and really the state of industry when it comes to digital health and partnerships. So we highly encourage, as I said, questions. You can use the chat option for that. That's probably the easiest way to do it. If you do want to use the raise your hand option as well, I will be keeping an eye on that so we can take you off mute to ask your question live. But this is a really great opportunity, as I said, to just feel free to interact with us and ask as many questions as possible. We highly encourage it. So with that, I am going to introduce Sophino Rourke and ask her to give you a little bit of her background, tell us a little bit about Goodwin, and then we'll jump right into the conversation.
Thank you, Rachel. Thank you to Massmetic and to all of you for taking this time to join us in this conversation around digital health. As Rachel mentioned, digital health is just, booming in so many different ways. So the question is, how do you get it in a way that's sustainable? And where are some really interesting opportunities that we're seeing that we're ready? Already were nascent before COVID and really accelerated. And where are some of the obstacles and challenges where there's really an opportunity to differentiate yourself by leveraging those opportunities and challenges. So Goodwin is an international law firm started in Boston, and we have very proud to have a very strong digital health practice. And what I think is really unusual about Goodwin is that we have a really strong tech, life sciences, healthcare regulatory, and then as well as private equity or VC practice. So we pride ourselves in being able to support our clients from, I have clients that are what I call, really early startups where it's a concept to the example that we've been using recently has been Moderna. And when we first had the opportunity to support Moderna was a growth company. So really along the entire continuum. And because we do have the opportunity and the privilege to work with so many companies in the medtech and digital health space to see what the industry is doing, to share trends, to share best practices and lessons learned. So great to be here. So I am a partner in the life sciences practice. I'm part of the healthcare regulatory team. So what's healthcare regulatory? For those of you who may not be familiar, it's all the regulations, whether for federal, state, or local, that apply to anything that touches healthcare. And I use a much broader definition of not just healthcare, but health and wellness. And hopefully we'll talk about that today. I started out my career with working for a large law firm in New York, and then eventually went in-house with a large health system called Ascension. And I think one of the things that we're going to talk about today is partnering with health systems and hospitals. So looking forward to sharing insight that I may share, and then join Goodwin. So great to be here. And as Rachel mentioned, would be great if we were in person. And I would say at the end of the presentation, please come up to the front of the room and ask me any questions. Obviously, we don't have that opportunity. However, you will have my contact information, and please feel free to reach out if we don't get to your question, or if you have a question that you think of later on, and I'll either get back to you or someone on my team is the most appropriate person to respond. So with that, again, thank you, and look forward to a robust conversation.
Awesome. Thanks, Delphine. So I want to dive right in then to something that you just mentioned about what those growth opportunities are, right? What are the opportunities I think we're seeing in the market right now, where perhaps there wasn't an opportunity before, or it was a limited opportunity, and there's a real kind of moment for these things?
Sure. So the most obvious one is what I call tele-everything, right? Because it started telehealth, now it's teleresearch, it's telepsychiatry, it's telewellness, it's telecoaching, it's so many different things. And one of it was, I think, confluence of COVID, and out of COVID, relaxation of the laws that were, convoluted, varied state to state, very restrictive in a lot of ways, and really were a hindrance to growth of telehealth. And to respond to the need based on, the need that COVID created, in what we call Section 1135 waivers, the federal government said, okay, we're going to relax some of these restrictions to enable access to telehealth. And, prior to COVID, there was a generally held view that telehealth would never sort of take on for a variety of reasons. If we're putting the regulatory issues aside, more senior populations wouldn't adopt it. Patients would really be turned off by the idea of interacting with their physicians or their practitioners virtually. And we found that's actually not at all the case. And that in addition to unmet need that existed pre-COVID, we've seen a need increase in need for access, that it's in large part been met by telehealth. Does that mean that everything can be fixed by telehealth? No, right? I mean, you're still going to need to go in, at least for a foreseeable future, for surgery, for interventions where you do need that hands-on intervention. But even, even orthopedic surgeons are saying, okay, let's start out with telehealth. We can have the consult in telehealth, which was sort of unheard of before. So, I think telehealth is an obvious one. And what we saw already was, digital health and medical devices saying, okay, how can we create either a medical device or really bring together both of those modalities, and that more and more. So, it's not just to have, an IVF option. It's okay, well, what's that digital interface? And then what we're also seeing as a growth area is the consumer now is controlling. We've been talking about consumer-centric or consumer-centered health for a while. And because the consumer is now not in a brick and mortar location, this opportunity to say, how do I communicate with the consumer? How do I make sure the patient gets the information? And perhaps even more importantly, how do I make sure the patient comes to me? So anything where I'd say it's a collaboration where you have digital health plus. So I think another example will be at home. More and more we're seeing their at-home tests, at-home diagnostics, at-home dialysis. So you have the digital health component, med tech component. What can you do to collaborate with others or possibly expand your offerings? So, maybe there's a smart home option. It's beyond Alexa saying take your pills, but an option that would say, okay, your glucose levels are high. So really thinking of shifting the paradigm to care outside of your traditional setting and into the home, into common spaces. And we're seeing go ahead.
No, I was just saying that's a really interesting concept too, as well, because, I think what we're seeing too as Massmetic is there's less resistance to that type of idea. But if I'm being honest, if I talk to more of the aging population, there's still a little bit of resistance to virtual. They don't necessarily trust it, right? They already think they're paying too much for health insurance. They already think it costs them too much for prescriptions. And now you're saying that a doctor's not even going to see you. You're going to have to get on the computer and speak with someone virtually who doesn't actually know your condition and is just kind of guessing and making, ballpark assumptions. There's been a bit of, I think, pushback on that from older generations or older populations who perhaps aren't as used to the virtual. But the smart home concept, I think, is something people can really easily get behind.
Mm-hmm. What we're also seeing is that, in the sort of the elderly population is obviously not uniform. So what's the risk? If getting on a bus is the way that you get to see your care, if you're already concerned about you're at risk for falls, if you don't have family or others who can bring you to see a physician, it's sort of that risk assessment. Maybe it's not their first choice, but part of it, let's say the initial intake, could be. Or, you mentioned that the physician doesn't know their condition. If there's data that supports that a physician can do the intake as easily by virtual as they can in person, we need to, and that's where we get to the education. Why is this maybe not what you're used to, but focusing on your outcomes and saying your outcomes will be as good, if not better, based on this modality? It might not be for every condition, though, but for certain people coming into a hospital setting and being at the risk of catching the flu is a bigger concern than having, a rash on their arm, right? It's like, where do we balance that?
Mm-hmm. Yeah, it's really great points. And one more follow-up quick question on this, and it's not something we discussed, but I'm curious about your opinion. Who do you think the onus falls on for that education, right? We've seen government step in at a very large level, I think, to try to educate during the pandemic. Now, was it all great? Not necessarily. Was it all perfect? But they've tried, I think, very hard to keep people informed and updated about their options, right? How and where to get vaccines, how and where to procure masks, et cetera. So do you think moving forward, the onus is still going to be on med tech and digital health companies to educate as to the benefits of digital and telehealth, or do you think the government's going to play a bigger role in that?
Well, the CDC, let's just take the CDC, has always had guidance on their website. The thing is, nobody looked at it, right? I mean, most people didn't even know what the CDC was before COVID. So that information's been out there. What we've seen during COVID is that information has been politicized. So, do you trust the CDC? Who's really neutral? Are you going to, buy into what your governor says if your governor's not part of your political party? Unfortunately, I think government, it's been undermined, right? The neutrality of the information. And hopefully we're going to move to a place where we have faith again in what scientists say. So it's not our politicians, it's scientists. I think as far as where's the onus, if you take the sort of traditional model of our grandparents, you sort of listen to the physician, whatever the physician said went. Okay, you didn't look on Google, you didn't do your own research. So that's already shifting. And part of the shift is being pushed by the government. I mean, the price transparency rules, for example, that went into effect on January 1st of this year. Those price transparency rules are saying, are focused on providing information to the consumer. And you can argue whether they work or not, but the idea is, if we know how much our care is going to cost in advance and the outcomes, which is a sort of a second part of it, but if we can shop for our health services, we will then decrease spend. So the government is pushing for consumers to approach healthcare like you approach, in a lot of ways, buying a TV, Who has the best price? Is it Best Buy? Is it, you know, whoever may be selling your TV? I think it's going to be the differentiator, though, and we're already seeing this, is if you can provide education that brings the patients to you. Who's going to provide the best education? Who's going to provide it in a manner where if you're Spanish speaking, you understand it? If you're elderly and maybe not as tech savvy, and that's an assumption that because you're elderly, you're not as tech savvy. If you're targeting, you know, an 18 to 22-year-old population, your message delivery and message content is probably going to be very different than a rural population on Medicare. So, you know, will companies need to do it? Maybe not. But if you want to have customers come to you, then education is a great opportunity to differentiate yourself.
That's a really great point. I think it's absolutely a differentiator, right? It's a chance to set yourself apart. And as you said, bring the user to you. And I think that's something that the consumer market obviously has been doing for a very long time. MedTech has been a bit, obviously, in most cases, it's unnecessary. Well, it's not most cases, in half cases, it's unnecessary. In other cases, it's just a very different way to do things. Like there's always education, but it's different. So I'm wondering then if we think about that from a partnership perspective, right? What are the ways to partner? I know you mentioned health systems. Obviously, that's one partnership area I'd love to cover, is how to understand the best way to understand what health systems do very, very well and make that something that you can learn from either education or understanding. So I'd love to understand, you know, your background, obviously working with health systems, and your perspective on that.
So, you know, health systems right now it's been a really challenging year and a half, right? For a variety of reasons, including that hospitals, and I think, you know, a lot of people sort of don't quite, because unless you're in the industry, why would you know this, right? People would say to me, oh, COVID must be really great for your clients because the volumes are really high. But that's not at all the case. So health systems or hospitals really make money off of, for a variety of reasons that we can dive into if that's of interest, off elective surgeries. So, you know, let's say orthopedics, the hips, the knees, the shoulders that aren't emergent, where people say, yes, I need a knee replacement, and an orthopedic surgeon can do 7 a day. So financially, it's been a real struggle for the majority. So yes, you hear of certain systems, you know, like an HCA posting very impressive profits, but the vast majority, it's been a challenge, particularly in rural environments. You know, FQHCs, Federal Qualified Health Centers, are eligible for funding under the American Rescue Plan for COVID, in relation to COVID expenses, because they were hit so hard. So if you're looking to contract with a health system, what I would suggest is, okay, what is the value add that you're bringing? And that's always the conversation with partners, right? But where are they now that's different than where they were a year and a half ago? And if they can't spend money, and what I mean by spend money is if expansion right now isn't a priority because they just don't have the money, how can you position yourself as, this is going to save money, this is going to decrease risk, this is going to improve your outcomes, this is going to, you know, more and more thinking of it from that lens rather than just going in and saying, this is going to cost you X, and it's a nice to have. So, you know, I think that is to think about, okay, and health systems are looking towards the future and saying, how do I compete? Because there's the core business, you know, emergency rooms, trauma, but a lot of other areas, they're competitors coming in from all over. You know, whether it's ambulatory surgery centers or urgent care centers or educational apps that say, we can interface with your patient, and then your patient will go in and tell the physician what he or she wants. So health systems looking and saying, how can I be innovative? How can I continue to differentiate myself at the same time that I can't spend all that much money? So where can you offer a solution where they see immediate results? Link it for them, connect the dots for them, rather than saying, okay, this is a software platform. Okay, this is an X platform. How is it solving their problems? And happy to get into sort of the legal component, but that's what I would say is sort of where the angle has shifted since COVID.
So would you say then it might be an area of growth opportunity is for, obviously simplifying or potentially adding a digital health aspect to elective procedures, right? If the time that it takes to do an elective procedure is halved, that's more money coming in that's directly hitting the bottom line.
Yeah. If you can turn around an OR room more quickly, if you can, decrease pre and post-op, if you can decrease no-shows, improve scheduling, anything that's going to increase efficiency. And then the other area is non-patient revenue. What are the opportunities? Is it a partnership? Is it a licensing? Patient levels are not up to what they were pre-COVID for most systems. So what can you offer that diversifies and or is going to be, what's a reimbursement model that maybe they haven't thought of? Even if you're presenting something that is, traditional, what's the angle that is going to be attractive? If your sales pitch is the same as it was a year and a half ago, I would suggest refreshing it.
Yeah, no, that's great. So then if we start talking about the pitch, right, in a hospital health system, who should we be talking to? And is that dependent on what you're selling, or is there a place you go to get started?
That's a great question, because it does depend on, and oftentimes we say, I have an in, I know so-and-so, okay? So the question is that so-and-so, you might know the chief medical officer, is that, is there a committee, for example, that's looking at all of the digital health opportunities? Is that CMO part of that committee? They're pretty distinct structures, approval structures. If it's supply chain, great that the CMO might be on board, but what's going to be the process for the CMO to be part of that decision making? Maybe he or she isn't part of the decision making. So I'd say stepping back, learning the organization and figuring out, okay, who, and maybe with your contact or, talk to your lawyer or talk to your business person, who is someone who's actually making the decisions? And what is the approval avenue? So I'll give you an example. If you have any software, okay, for many health systems, if there's any software component, it needs to go through the entire IT or IS approval process, okay? And you might say, but that's just a really small component. Okay, but if it plugs into the EHR or in any way touches on the EHR, it's going to have to go through the software route. So to think about in advance, do your due diligence and figure out where in this organization do I need to get buy-in, instead of just sort of sending out and saying, okay, well, it must be supply chain. Maybe it is, maybe it's not. Recently, I had a client who said, I've been waiting on this large academic medical center. I've been waiting for them to send us term sheets for 9 months. I said, okay, let me call, my contacts in the office of the general counsel. And they said, well, no, we never send term sheets. You have to send us a term sheet and we'll react to it, okay? So what is their process? And these are questions that you can ask at the outset. And then the other piece is, again, going back to my comment about audience, what are they going to care about? Whether you're a committee that's approving medical devices or, the legal department, what are you going to care about? what's the risk that you're going to care about, and think of ways to proactively address it. So, give you an example, cybersecurity. Be proactive. I see these contracts that come in where there's going to be PHI exchanged, and they say, okay, we're HIPAA compliant. HIPAA's great, but that's not really the main concern these days. As healthcare is the most cyber attacked industry. So trying to preempt and say, okay, if I'm a health system, what do I really care about from a risk perspective, and answer those questions. Don't wait for them to get back to you and say, hey, do you have cyber and security insurance? Be proactive.
Yep. Yeah, no, that's great. We actually have been talking a lot about that with members, because it's obviously a very hot topic, and it's probably a subject for another day. So I won't ask too many questions on that. But I do, this may be really hard to answer, but what do you think the typical life cycle of partnering with a health system looks like from a timeline perspective? I mean, you just mentioned 9 months waiting on term sheets that were obviously never going to exist if you hadn't pushed very hard to understand the process. How long can something like this take?
A year and a half, 2 years.
Okay. Yeah. And I would assume that's after you've identified the right person to talk to. If you're still hunting, then it could take even longer.
Yeah. And that's why also, when you're negotiating, what is going to be make or break? And thinking about like a BAA agreement. If you're partnering with a large national health system or a large payer, the Blues are not going to take your BAA agreement. It's not worth fighting. What are things you're like, okay, recognizing the leverage and saying, what is so critical to me that I can't give in on this? Negotiating generally with a health system is not a sort of intense negotiation on TV where you're going back and forth. I mean, there might be some agreements, but a lot of it's going to be, okay, you send a draft. A month later, you get some comments. So if time is critical for you, thinking about strategically, what do I really need? And is 15 days payment, that's pretty unrealistic for most health systems. Don't include really need it. Think about, this is not a leveraging, if you want to move quickly, a leveraging opportunity to practice your negotiating skills. But to think about, what is the end goal and how important is time to you?
That's a great point. Yeah, absolutely. So I'm curious as to your opinion too on med tech or traditional, med tech or digital health companies trying to partner with non-traditional med tech companies, right? You look at the Apples, the Fitbits, the everyone who's strapping something to your body to grab some data from you that is not a medical device. And then we look at digital health companies that are trying to really use that data to make decisions and to influence diagnoses, but have to come up and then go create their own wearable. What kind of intersections are you guys seeing there?
So that there are a couple, we'll unpack that one. 10 years ago, we used to call them non-traditional stakeholders. Amazon, Apple, Walgreens, CVS, anyone who hadn't been, sort of a physician, a hospital, insurance plan were non-traditional. So now or a Johnson & Johnson, et cetera. I would challenge that. Are they non-traditional at this point? No, they're not direct patient care, but they're going to get there. Apple has clinics. Apple has clinics that currently are focused on employees, and this is just speculation, because why would they stop? And we've seen other companies do this. They model, work out the kinks with their employees and then offer it more broadly. Maybe it's to employers in the region, or there's a telehealth component. So I would say one is, okay, so let's think about them as they're now part of the landscape, and they're a step ahead, because to your point, they're already on us. They don't have to convince us to, to put on a, you name it, Blue Cross Blue Shield wristband, right? We are voluntarily not just putting on this data acquisition device, we're paying for it. So in a lot of ways, it's sort of the Microsoft model. The number of risks that they can get on, they now have a delivery platform, or an Amazon model. Amazon just keeps on adding and adding products. So I'm circling back to the second part of your question. If you're thinking about partnering, the barriers, unless you have something fabulous, and there are examples, right? Unless you have something that's really breakthrough, that's going to push away, that's going to supplant the Apple Watch or the Fitbit, that's going to be a tough mountain to climb. So what is it that you have that you could layer on and use the delivery mechanism that's already there? That's a differentiator. So, I wouldn't spend all that much time developing a new wearable unless it's something, very specific. Maybe it's for diabetes, it's end-stage renal disease. But if you're looking at an overall, how can you deliver to the greatest number of people? I would suggest partnering. Now, there are obviously, there are downsides to partnering, but they might outweigh trying to develop something that is entirely new.
Yeah.
Now, what? That may change. We have cars now that are going to, or future models that are going to record your blood sugar levels, that are going to be, so maybe it won't be a wearable. Maybe you'll walk into your house and you'll be scanned. But for now, for the short term, they've really cornered that market.
Yeah, that makes a lot of sense. So, I mean, obviously, some then advice that you would give to early stage companies is don't try to reinvent the wheel that already exists.
I'd say unless you're going to come up with something really novel, if it looks like an Apple Watch or it looks like a Fitbit and does the exact same stuff that the Apple or Fitbit does, why put all that energy into it when you could probably add value in a very different way? If you say, okay, now I can do it, in directly through, I don't know, a chip, who knows? But if you have something that solves the issue, and the Apple Watch was criticized for being unattractive for a long time, and that women particularly weren't interested in wearing it because it was viewed as, clunky, et cetera. And now you see, more bracelets than you could ever buy, and sort of it's, become part of not only a look, but a sort of saying, I'm connected with my fitness and my health.
Yeah. So I think that comes back to something we were talking about offline about data and the data dilemma in healthcare innovation. Would you mind sharing a little bit about that?
So yeah, I call it the data dilemma because we know that data is so critical and data is the future. And just making that connection, for example, with telehealth and the elderly is looking at outcomes and not looking at outcomes subjectively, but really saying, okay, what are, let's use end-stage renal disease. How are you decreasing mortality rates? Give us concrete numbers, and that's where consumers are going to move, particularly younger generations that are used to looking at a hotel and looking for data points, looking for a spouse using data points, so familiarity of, okay, I'm going to have, knee replacement. Well, what do your outcomes look like? What are your infection rates? What are your blood loss rates? What are the costs of that implant? Have there been any recalls? So that's what we're going to go towards, a much more informed consumer who's more comfortable using sort of data to motivate medical decisions rather than a relationship. For years, it was, I have a relationship with my physician knows me, and therefore I feel comfortable relying on what, generally he you know, I mean, I remember my grandmother her physician could tell her anything. She wouldn't even question anything he said. She'd take the day off from work. It was like, you know, genuflexing to the physician. Those days are over. He was older than she was, and she died at 89, right? And okay, you know, she was happy. But that's not the future. So on one hand, we need data to improve care. Consumers want data, yet the flip side of that is, you know, we talked about security breaches, we talked about HIPAA breaches. What a lot of people don't, I think, appreciate is HIPAA only covers certain relationships. It doesn't cover relationships between third parties. So I'll give you an example. There are sites, for example, that help you manage a chronic condition. Maybe it's migraines. And they ask you to give them permission to link to your electronic health records, so that that site and that coach, if they have a wellness coach, this is pretty common, can access your medical information. And they say, this is great because we can send information to your physician. Well, as soon as you allow that, HIPAA doesn't protect that information anymore. So all of a sudden, giving our medical data to third parties without protection creates a lot of risk for a variety of reasons. Our data could be sold. We could, you know, as we know more and more about genetic makeup. So it's that, how do we ensure that we have the protections we need? And going back to education, I think there's a lot of opportunity to educate the population generally on privacy. You know, some people said, oh, I don't want I don't want my COVID status to be reported to the government, yet your credit card or your Google app knows where you are every second of the day. So, you know, so I think it's that piece, is how are we going to package data for med tech companies and digital health companies, package data in a way that protects and informs the consumer about both the value and the risk of data that they're going to share.
Yeah, that's a really great point, because we've definitely, you know, we've obviously heard that, right, from a number of people is I don't want the government to know. I don't want the government to know. But you're absolutely right. We are giving our information away to companies that I'm not sure have a much better reputation than the government, to be honest. And we do it under the guise of, oh, this makes my life easier to just share this information. It's not that big a deal. They don't know that much. Well, they know a lot more than we think that they do. And yet, you know, I think where I come back to is you're absolutely right. We need that information to be something that we can access. You know, if I go to the internet right now and I start trying to look for, the number of recalls on a certain type of hip implant, because that is what my elderly loved one is thinking about getting, and I want all the information, it would be a nightmare to pull all of that together. Everything I'd want to know about the doctor, about the place where they'd be having surgery, about the actual implant they'd be getting, if I could even get my hands on that information to begin with, tracking down the statistics around that would be an absolute nightmare because of what the internet has become. So do you think, I mean, what's the opportunity that people should be thinking about? Should they be the provider of that information? Should they be the gatherer of that information? Do they want to be the, you know, what's the big opportunity there?
Synthesizing the information. There's a ton of information out there. It's like information overload. How can you translate it to a usable format? Whoever your audience is, if your audience is physicians, if your audience is family members. I mean, going back to the at home, think about if you have an elderly parent and you ask them, oh, you went to the doctors today, if you didn't take them. What did they say? What pills should you take? I mean, some people are much more aware. Imagine if you could just scan or have the results of your blood work, or you get to ease of convenience. If you have a parent in a senior nursing facility, for example, and you said, oh, if I could pay X amount more and know exactly how mom's doing, a lot of people would do it because it would make their lives easier. It would decrease stress. It would decrease, you'd say, oh, okay, mom took her pills, or, her blood pressure was high, and have that conversation. So I think anything that we're at a point where there's so much data, and that was a problem with the hospital price transparency. And if any of you have not gone on, I encourage you to do so just as an exercise. Every single component of your care or potential care is now listed. So if you're going to have, I keep on using knee surgery. Okay, I need some blood. Well, how much is that going to cost? Okay, I need a hospital gown. Okay, how much is that going to cost? It's too much information. Who's going to go in? First of all, you don't even know what you need. And second of all, it's too much information. So if you have an opportunity to create digestible and useful information that has a value add.
Mm-hmm. Yep. Okay, so we do have about 15 minutes left. I want to remind the audience, if you have questions, please pump them in, because we've got enough to keep, we've got at least one more topic we could cover, but I want to make sure if there's anything you would like to ask, please put those into the chat. I think then, Delphine, while we're waiting and see if any questions come in, I'd love to talk about the women's health and wellness practice that I know that's a passion for you. And honestly, what we've been hearing is, for such a long time, women's health was not something investors were investing in. It was not something that med tech and digital health were really focusing on. It was a really untapped opportunity. There's definitely been a shift in the last, I would say, year, which is fantastic, right? We're seeing more and more opportunities. We're seeing more and more products, and female-led companies that are addressing these issues. It used to be just a few major medtech companies who made women's health products, and it seems like that momentum is shifting a bit. So I'd love to hear about the work you all are doing on that, and if there's a digital health application as well.
So we're very proud. We launched 2 weeks ago our women's health and wellness practice, which is, as far as we know, the only and first practice of its kind, particularly, international major law firm like Goodwin. And it is not a new initiative. We have been advising women's health companies, women's health wellness companies, life science companies that were developing drugs for conditions that either disproportionately affect women or only affect women. We were advising investors in the space, for years. What we thought was important, because clients were asking us for it, is to package it. They're saying, we're not quite sure where to go. We want a complete offering. We want to make sure that we have employment lawyers who understand the unique issues, that we have, corporate lawyers who understand the unique issues. And we had those, so we brought them together, and, invite you to check out our website, into one umbrella practice area. So we're very excited about that. Women's health is a huge opportunity, and just, Google women's health investment over the past 2 years. It's growing at 15% plus a year. Digital health, some people call it femtech. So it's digital health focused on, again, issues that either disproportionately impact women, such as thyroid disease, or issues that are specific to women. So, couple factors. It's been ignored and underfunded. So what's great for investors? Areas that have been ignored and underfunded, right? Second, women are the chief medical officer of the home. 80% of healthcare decisions are made by women. Same with on the financial side, 90% of consumer decisions are made by women. 56% of households, there's a single woman. So the woman's at really the center of healthcare decisions, not just for herself, for her immediate family, but the data is there for her spouse, for her parents. COVID, women, again, the data supports that put other people's health and healthcare before their own. And that was exacerbated during COVID. And I think that's part of the reason why you're seeing tele as such an attractive option, is women who are working, taking care of kids, who were learning virtually, plus elderly parents were afraid to go in and catch COVID. They're saying, we want better solutions. You know, we want solutions that meet our needs, and our needs are different than a man's needs were 15 years ago. Last point, and I think this is an area, if you're not focusing on women's health, you know, this idea that women's health was, you know, just reproductive health is being blown apart, and saying, let's look at women's health throughout their entire lives. And let's look at women's health is also heart disease, it's osteoporosis, it's mental health. It's not just about, you know, whether or not you're birthing children or whether or not you're entering menopause. And adding a gender lens on all aspects of health. You want women to buy your product, you want women to come to your facility, focus on the issues that are critical to women. You know, advertise in a way that's going to attract women, provide options. You know, urinary incontinence, I think, is a great example. What are options? We're seeing great med tech in that area. That's an area that nobody talked about before. And women are saying, it's not because my grandmother put up with it that I need to put up with it. So what are the solutions? You know, and if my physician can't give me solutions, I'm going to research those solutions and I'm going to seek them out myself. So really an area that I would encourage you to focus on. You know, more than half the population is female. So to not focus on it seems like quite a blind spot.
Yeah, I would say, you know, too, based on the conversation earlier, what do women not have? They don't have time. They do not have the time, most women, to do all the research, to figure things out. They want to, and they have the initiative to, but most of them do not have the time in the day to make that happen. So make it easy for them. Make it easy to understand what the benefit of your product is and how it's going to impact their daily life. I think more than anything, that is what women need when it comes to, if you want to sell to them, how are you going to make their life easier and quicker?
Yeah, and how are you going to increase the quality of the experience? You know, again, and the younger generations are saying, you know what, why is it this way? Why does getting a mammogram require me to be in a robe or a gown that like is open in the back and everybody can see? I mean, you know, like why? You know, questioning and saying, yeah, I don't want that anymore. You know, I want something different. Or why do clinical trials not involve women? Or, you know, all these areas, and also generational shift of what are you willing to talk about? Things that were taboo previously, where now it's part of the conversation. Women are also living longer and saying, you know what, I want to be healthy in my 80s, and I'm not going to put up with certain conditions that we were, you know, previously told that was just sort of part of it. Men are doing the same thing. I mean, men are saying, hey, you know, erectile dysfunction, I'm not going to live with that. I'm not going to live with X, Y, and Z, and women are doing the same thing.
That's awesome. Okay, so we did have one question come in from the audience. So could you provide some additional information about how startups can decrease risks around accessing EHR or displaying, you know, electronic health record info? Are there specific resources that can be accessed to help clarify what you need to do to be compliant?
Great question. Now, I would start by thinking about, first of all, do you really have PHI? So that's a question that I see, you know, come up quite a bit. It might seem simple. People say, oh, well, I'm subject to HIPAA. Okay, well, do you have private information or do you really have patient health information? Okay, if you decide that you do, or you do the analysis and you do in fact have patient health information, are you covered by HIPAA? Are you a provider? What is your role with that PHI? Are you simply a clearinghouse, you know, or are you providing care? HIPAA has specific exceptions. For example, if you're billing for a hospital, there's an exception within the HIPAA law that you can have that PHI. So as far as a resource, there's Office of Civil Rights, I haven't checked it recently, but they used to have, and have had very recently, I just haven't checked it in the past couple of weeks, user-friendly, so that's the entity that enforces HIPAA, Office of Civil Rights. They have very user-friendly information on HIPAA. And the question is, does HIPAA apply to you, yes or no? And I would, start with that. And then if HIPAA does apply to you, are you a covered entity? Then you need to have a BAA agreement. Those are pretty standard and they're available on the internet. Most likely, if you're contracting with a larger party, they have their BAA. So big companies all already have a BAA, even medium-sized companies. So I wouldn't spend too much time developing your own BAA because it's unlikely they're going to use yours. So if you are plugging into EHR, I would start out by, if you're entering into conversations with an entity, ask them, what are your requirements for a company that's going to plug into your EHR? They more than likely are going to have requirements. It could be that you have a certain level of cybersecurity insurance. It could be that you have firewalls. Don't guess, ask them. Now obviously, you want to have encrypted, encrypted lines. But I'd say start out by figuring out if you even have PHI, what your obligations are to protect that PHI, or how can you use it? And then at the outset, engage with your partner on what's going to make them feel comfortable. You need to have audits, and give them, make sure that they feel like you are in control of the patient health information. Which employees have access to it? How do you audit? If you think there is a breach, these are questions we always ask. Who does it go to? Do you have somebody in your organization? If you're a startup, you're not expected to have an entire compliance department, but if you do think there's an issue, who's in charge of that?
Yeah, that's great. Okay, we did have one last question come in, and this is actually a huge topic that we talked about offline as well. When it comes to the regulatory landscape for digital health, obviously, as we mentioned earlier in the call, things have loosened over the last year. We're finally allowing payments where there's an accelerated model, right? It's becoming more acceptable. Rather than dive too deeply into it, I guess my first question is, do you think that's going to stick?
Yeah. And then, that's the, $3 trillion question. Is it going to stick? So I want to be mindful of our time. The Section 1135 waivers, because I get that question a lot, are the 1135 waivers or the waivers going to stick? Those can't stick because under the Social Security law, they can only be in place so long as we have a national emergency. So once President Biden declares that we are no longer in the middle of a national emergency, you won't have those specific waivers because they're dependent on the national emergency. Okay. That said, certain states have already implemented and passed laws that are similar to the waivers. So, let's use the telehealth example where you don't need to have, for example, a physician-patient in-person interaction before you can bill for telehealth services. The expectation, and the administration has been sort of sharing or leaking out that this is the goal, is to have a federal telemedicine law. So it wouldn't vary state by state because that's a huge challenge. I have clients who say, okay, we want to be in 32 states and there are different requirements in every single state. So I think we can expect standardization at a federal level. The question that's on a lot of people's minds is, what do we do if there's a gap? What do we do if the national emergency ends because the COVID levels are low, et cetera, but we don't have a federal telemedicine law in place? So that's where I've been advising, you need to have two models. If your entire company's model is based on the current waivers, that's not sustainable. You can, yes, pray and hope that it's going to continue, but you need more than that. Other areas, so for example, there's HIPAA waivers so that you can have interactions using FaceTime, have interactions using platforms that previously weren't permissible. I think those are going to continue in part because, and what we haven't talked about, and this is really, I think, an opportunity, is the digital divide. And I'm seeing, investors are saying, okay, this is great. So what do you do about the digital divide piece? What do you do about the fact that X number of Americans don't have enough bandwidth to even access? What do you do about the fact that if it takes all these data, if whatever your product is sucks people's data, they're not going to use it? So, and so the solutions that use platforms that Americans have already adopted and don't exacerbate that digital divide, I think that's where we're going to see flexibility. We need to make sure that Americans who are on Medicaid, that they're part of the solution, for example, and not completely cut out.
I think that's a great topic for the next session. We're going to be doing 3 more of these with Goodwin, and I feel like that's a great one to dive into. And the next is really understanding that digital divide, because you're right, we didn't even touch on it, and it's such a huge either, it can be a hindrance to adoption, or if you do it well, it can be, the opportunity to differentiate yourself and say, we're going to make this easy for the people who are most likely going to have trouble accessing. And I mean, and that's not just the elderly population, right? That's lower income populations, that's worldwide populations, right? If there is a lack of access to internet, Wi-Fi, reasonable technology from our perspective as, with digital health, we're creating a great app. Well, if no one can get onto your app and it sucks all of their data when they do, what have you done to the system, and why is everyone going to want to use your product? So I think that's probably a really great topic for next time as well.
It is one that we're investors are asking because they realize it's going to be, it can hinder growth. You can have a great platform, but if people can't access it, even if they have money, just because you can't access it, or because it's going to become an issue just more and more around social justice issues, that a solution. So again, I think what it is though is an opportunity, and it's an opportunity to partner, talk to a Comcast, talk to some of these other broadband providers who are also looking to be part of the solution, because that needs to be part of the solution. And it's not just a rural health issue. There are other concerns. I mean, we've seen in the educational space, and it's a similar issue in urban spaces. So, I think out of every challenge, there is an opportunity, and it's a really exciting time to innovate in the healthcare space. And, thank you for the opportunity to have this conversation today.
Thank you so much, Delphine. This was a fantastic opportunity to get to pick your brain and learn more. And thank you to everyone for joining us for this event. We will be sending out the video afterwards to everyone who registered. So we'll make sure that there's contact information so that you can ask Delphine and the other partners at Goodwin any of your questions regarding the stuff that you didn't feel comfortable over the platform, which we totally understand. So thanks, everyone. Have a great rest of your day.
Thank you.